Hi there. Thanks for visiting caregiverrelief.com. Our website is for caregivers. We know that being a caregiver can be challenging, but we're here to help. Our website is full of useful information that can make your life easier. So if you want to stay up to date with our latest content, be sure to subscribe to our email list. And as a subscriber, you'll get access to exclusive content that isn't available to the public. Don't miss out on all the great resources we have to offer. Subscribe now and start benefiting from our expert advice and support. And thanks for watching, and we look forward to supporting you on your caregiving journey. Today's lesson is vascular dementia, the most preventable type of dementia. Vascular dementia is sometimes called subcortical vascular dementia because it affects the brain's subcortical structures. And these structures are responsible for controlling our behavior and our cognition, or our thinking processes. It is the second most common type of dementia, Alzheimer's disease being the most common type of dementia that most people are familiar with. Vascular dementia is the most preventable type of dementia. Vascular dementia is a complex brain vascular disease, meaning it's the blood supply to the brain, that has serious consequences if not treated correctly. With early detection and healthy lifestyle changes, however, it can be managed successfully to improve a person's quality of life. Vascular dementia is caused by the brain's blood vessels experiencing a decrease or reduced blood flow to the brain. It often results in deficits in thinking, reasoning, memory, and poor judgment. This condition can occur at any age, but it's most common in people over the age of 65. So let's talk about the risk factors and the underlying causes of vascular dementia. As we age, the chances of developing vascular dementia increase dramatically. Heart disease and stroke are well-known risk factors for this disorder, but it is also something called atherosclerosis, which means deposits of cholesterol forms plaques in our arteries, and that can potentially block blood flow to the brain. This buildup of plaques causes vascular dementia. A history of heart attacks or stroke also increases one's vulnerability, making it critical to be proactive about managing health as you get older. Elevated levels of low-density lipoprotein, LDL, or the bad cholesterol, are associated with an increased risk of vascular dementia. Diabetes, smoking, obesity, and atrial fibrillation. Together, these are powerful risk factors for vascular dementia. High glucose levels, or high blood sugars, can destroy blood vessels throughout the body, resulting in brain damage. Smoking contributes to vascular disease. It damages the blood vessels directly, leading to atherosclerosis. Of course, being overweight increases your chances to develop vascular dementia. Atrial fibrillation causes dangerous blood clots to form in the heart. If they break off, they could travel to the brain, causing strokes. Knowing and managing these risk factors can help reduce the chances of developing this condition. Underlying causes of vascular dementia range from small strokes, also called transient ischemic attack, TIA, to a full-blown stroke. This stroke can occur suddenly. A transient ischemic attack is often called a mini stroke. Again, TIA is a mini stroke. And a person may show stroke symptoms that resolve quickly. I had a client that had many TIAs over the years. She would call first responders when she experienced notable symptoms. By the time the first responders arrived, the symptoms had already resolved. Now, I was out with Charlotte having lunch one day. She liked to drive her big Ford pickup truck, and we were on our way home, and as she was driving, she had a TIA. Her speech became slurred, and on one side of her face became droopy. I was able to get her to pull over and let me drive, and I took her to the ER where they observed her symptoms. At that time, upon presentation to the ER, she had very high blood pressure. Then, while in the ER, her symptoms resolved and she was sent home. She was diagnosed with small vessel disease that caused her TIAs. Over the years, Charlotte continued to have many strokes. Over time, vascular dementia symptoms started to become more apparent. Her brain function was impacted by her uncontrollable blood pressure. Charlotte also had diabetes and was non-compliant in managing her blood sugars. This resulted in high cholesterol as well. All of her lifestyle choices contributed to causing further damage that would affect the blood vessels. These increased her risk factors for vascular dementia. The cumulative effect of all the mini strokes led to changes in her sleep patterns, slowed thinking skills, and some memory loss, and oftentimes the result was poor judgment. For many years later, Charlotte suffered a major stroke. During a stroke, a ruptured blood vessel causes damage to a large area of the brain, or blood clots will affect blood flow and cut off the brain's blood vessel supplying oxygen-bearing blood to the brain. This affects the brain functions in that region of the brain. Over time, brain cells die, and a person with vascular dementia will have memory issues. They may start to have difficulty performing tasks that were once familiar, or having difficulty recalling current or even past events. Strokes can come in many forms, from silent to apparent massive strokes. However, each stroke increases one's risk of developing vascular dementia, especially when multiple strokes occur over time, and they cause multi-infarct dementia. Similarly, brain hemorrhages due to high blood pressure or aging also cause a leading source of damage. As we get older, it is therefore important for us to take steps towards reducing our risk associated with these life-changing health conditions by promoting healthy lifestyle habits now and before it's too late. It's often hard for medical professionals to distinguish from other related diseases and conditions because of shared symptoms such as problems with memory and confusion. Vascular dementia may also be caused by diseases such as Alzheimer's disease or Lewy body dementia. These conditions are linked with the development of deposits in the brain's small blood vessels. Many people are unaware of the different forms that vascular dementia can take. Mixed dementia is when 2 or 3 types of dementia occur at the same time. The most common symptoms of both Alzheimer's and vascular dementia are present in the patient at the same time. Researchers have discovered a condition called cerebral amyloid angiopathy, which is CAA. This is a condition that affects the vessels in the brain. Cerebral amyloid angiopathy causes proteins to build up on the walls of blood vessels in the brain, which can lead to decreased blood flow and damage to brain cells. There are now clinical trials to understand how the protein buildup differs from Alzheimer's disease and other types of dementia. And just FYI, Alzheimer's disease and Lewy body dementia have different types of protein buildup causing vascular dementia is a new finding. Alzheimer's disease patients frequently exhibit the same symptoms of CA. Multi-infarct dementia, also called vascular cognitive impairment, is caused by repeated blockages to blood flow in the brain by blood clots. This gradually leads to noticeable symptoms as these cumulative effects start to manifest over time. And over time, the brain damage caused by these ruptured blood vessels and brain tissue will cause symptoms of vascular dementia, such as problems with memory, difficulty recalling current or past events. Multi-infarct dementia will have different signs and symptoms because it affects many different regions of the brain. Vascular dementia is caused from blocked blood flow to the brain, leaving the brain tissue deprived of essential oxygen and nutrients. It can be caused by a stroke or other conditions impairing circulation, with its severity and location determining whether thinking processes are affected. Simply put, the symptoms of vascular dementia will depend on the regions of the brain tissue and where the damage occurred. Each region of the brain has different functions. The symptoms of vascular dementia depend on what region has been damaged. A person with vascular dementia will exhibit different symptoms. They may develop cognitive impairment, meaning problems with their thinking skills. These thinking skills include reasoning, judgment, planning, and memory, things we all rely on in our everyday lives, but without proper care could potentially go awry due to reduced cognitive function associated with vascular dementia. So, how is vascular dementia diagnosed? To accurately diagnose vascular dementia, a doctor must ask detailed questions about problems with daily activities, and they will administer memory or thinking tests to the patient, and they'll even interview family members who can provide insight into the symptoms they are observing. Additionally, medical history review, as well as lifestyle checks and brain imaging, are often conducted for further investigation of whether vascular dementia is present. Sadly, there isn't anything that can reverse damage already done by stroke-related incidents, but treatments targeting prevention of future strokes, such as blood thinners, are regularly suggested. Medications aiding in treating Alzheimer's system also have been known to assist those with early onset stages of vascular dementia as well. Further recommendations typically include treatment management for risk factors potentially linked to such an illness. A common method of diagnosing vascular dementia is magnetic resonance imaging, which is an MRI scans can detect changes in the brain caused by vascular contributions and allow for early diagnosis. Additionally, other tests such as a blood test, urine test, or cerebral angiogram may be used to confirm vascular dementia diagnosis. By diagnosing vascular dementia early and controlling risk factors, you can help protect yourself from its devastating effects and future damage to blood vessels. So, what are vascular dementia symptoms? Vascular dementia symptoms vary depending on the part of the brain where the blood flow is impaired. Symptoms often overlap with those with other types of dementia, especially Alzheimer's disease dementia. But unlike Alzheimer's disease, the most significant symptoms of vascular dementia tend to involve the speed of thinking and problem solving rather than memory loss. Vascular dementia can present a range of signs and symptoms that may suddenly appear following a stroke. These include confusion, difficulty paying attention and concentrating, slowed thinking processes or organization processes when planning actions. Memory issues are often experienced alongside restlessness or agitation, as well as depression and apathy. A person's gait or one's gait may become unsteady. The ability to urinate may also be affected. Some people with vascular dementia may experience sudden urges to urinate. This can become more frequent at times, even losing control and becoming incontinent. When these signs occur together after suffering from a stroke, they're referred to collectively by the name post-stroke dementia. Vascular dementia and Alzheimer's disease are closely linked, and as I said before, they sometimes occur together in a person. This type of dementia is often characterized by drastic changes to thought processes following strokes, and many strokes can cause deterioration more rapidly than what we're even seeing when we observe someone when they're having their stroke. Evidence shows many individuals live life while dealing with both forms of the degenerative disorders simultaneously. I'm often asked by a family member after they have vascular dementia diagnosed, is it hereditary? So, is vascular dementia hereditary? It is not usually a hereditary disorder, but there is a condition called CADASIL, CADASIL. That's an acronym for cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. Again, it's CADASIL. Now, this is a hereditary condition causing vascular dementia, and it's passed to children born of one parent carrying the gene. Early onset symptoms such as migraine, headaches, and seizures typically manifest in the middle age, but can be latent until later life. It affects the blood vessels in the white matter of the brain, and this can cause severe depression. So if you're concerned about your risk for vascular dementia, consult your doctor for further advice. Now, let's talk about how vascular dementia is treated. Suffering from vascular dementia can be difficult and a devastating experience with no known cure. However, treatments focus on how to improve blood flow to the brain. These approaches have proven successful in reducing further damage of associated tissue as well as providing relief from some symptoms. The measures to treat vascular dementia may involve taking various medications, such as those that regulate cholesterol or treat diabetes. Of course, undergoing lifestyle changes like following a healthier diet, becoming physically active, quitting smoking, etc., and even procedures aimed at directly addressing compromised blood flow to the brain through cardioendarterectomy, angioplasty, and stenting are all options that we can look at to treat vascular dementia. I'll give you a little anatomy lesson here. The carotid arteries are located in the neck and provide blood flow from the heart to the brain. While treatment won't undo existing brain damage due to vascular dementia, it could significantly improve quality of life now, giving people suffering from this condition hope once again. So let's talk about how to prevent vascular dementia. There are several measures you can take to help prevent vascular dementia. If you listen to my audiocast, you will hear me say, what is good for the heart is good for the brain. Heart disease and brain health are closely related. Taking care of your heart not only benefits your heart, but could also be instrumental in protecting your brain against vascular dementia. To reduce the risk and keep a healthy brain, one should strive to maintain a normal blood pressure levels, as well as preventing or controlling diabetes through dieting and exercise. In doing so, you may guard yourself from both Alzheimer's disease and vascular dementia. It's important to maintain a healthy lifestyle by eating a balanced diet, getting regular exercise, and avoiding smoking and limiting your alcohol intake. You should also work with your doctor to monitor and manage any conditions such as high cholesterol or atrial fibrillation that increase your risk of vascular dementia. By following these steps and understanding vascular dementia, you can help protect yourself from its devastating effects, as it is the most preventable type of dementia.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.